we're hearing about people going on social media posting that they've made what they're calling mask exemption cards. They're fake, and they're using them to wear them in places where masks are now required by law. Some of them are using the Canadian Red Cross symbol. This is probably just for Minister Elliott again. I mean, what is your take on that? Do you think there needs to be stronger laws in place, perhaps from a provincial level, to make sure people aren't flouting the rules in this way?
Yeah, I heard about that, and I first of all, I want to thank the Red Cross. What a great organization, and it's unfortunate that people are using their logos, and I understand they're going to possibly be taking action, but you know, this isn't the time to put fraudulent cards to get away and be able to go into the store. To be responsible. Don't be a scammer and, you know, say that you can't wear a mask and make up some fraudulent cards. It's unacceptable in my opinion. Everyone else is wearing a mask when you go into stores. Wear a mask. Wear a face covering. If you don't have a mask, wear a face covering. But as far as I'm concerned, it's totally unacceptable.
My question is in regards to the creation on social media of fraudulent medical exemption cards for those who don't want to wear masks, and they're offering to distribute them to those who also don't want to wear them. I'm just wondering if you could both respond to what you think about that, and if Dr. de Villa, if you could clarify which precise medical conditions would actually qualify a person to not have to wear a mask indoors.
Well, may I begin by simply saying there are no such cards that are required, and you know, I can't speak to the motives of those involved in this particular scheme, but I will say that you know, just like there's a million stories in a big city, in a city of 3 million people, there are a fair number of people who engage in scams of one kind or another. These kinds of cards are not required, and I would just hope that people would be very wary of purchasing one because it is not needed. And you know, be very careful about who they're coming from. But they're not needed. I think that's the main thing to observe, and perhaps Dr. de Villa can talk about the people who are entitled to an exemption under the bylaw.
Yeah, so thanks, Mr. Mayor. And you know, just on the notion of fraudulent activity, which is exactly what it is, as you described, Matt. I mean, I think any kind of fraudulent activity is always disappointing. But I would point out that it is generally perpetrated by a very small number of people in our city. It is a big city, as the mayor points out. But thankfully, you know, our sense is that as a city, we have banded together to fight COVID-19 together. And I would say that Torontonians, by and large, have really followed public health measures and have come together as a community to protect ourselves and each other as best we can. And we know when it comes to the issue of masks, this is perhaps one of the most community-oriented actions that each of us can take, and it's a relatively simple and inexpensive one. And I think it's really important. I can't say enough. I wear a mask to protect you, you wear your mask to protect me. How much more community-oriented can you get? And I think that's a very positive, a small measure, but still an important city-building measure that we can all engage in. When we talk about what is available, I won't go through a whole comprehensive list around what the bylaw says. Lots of details available on the website, but suffice it to say that there is no you know, proof or card that needs to be shown in and around those medical conditions that might actually prevent somebody from safely wearing a mask. We know that younger children are exempt from that, for example, and those who have a condition of any kind, a medical condition that makes it complicated to wear the mask for a variety of reasons. It may be a question of breathing or heart troubles, or it may be a question of a developmental or a cognitive issue that makes it difficult to take on and off the mask. Those are a few of the conditions. But suffice it to say that so far, what we have observed in the community is an increase in mask use, which fundamentally shows that we are, as a city, you know, really, I think, very community-oriented and interested in actually protecting each other.
Can I just add one more thing, Brad? You know, the notion that people are out selling these cards implies that there are people out there interested in buying them. And you know, I think consistent with what Dr. de Villa said, people are responding to the advice and yes, a bylaw that requires them to wear a mask, whether it's in indoor spaces or on the transit, on their own, because they understand it's making a difference. They can see that we're doing better while we still have work to do than in other places where this is not as prevalent. And so, you know, to those scam artists who want to try and sell these masks, I don't think they're going to have a big take up on that. It's more of a political thing, and it is not honest and straightforward with people. But I just am so gratified, and I want to say thank you to the people of Toronto for the cooperation we can see with our eyes is happening with respect to the wearing of face coverings. It's really very gratifying, and it's going to help.
Thank you. And just to follow up, for Dr. de Villa, when it comes to people who are opting out for legitimate medical reasons or the reasons that you stated, how should they adapt their behavior inside a store, inside somewhere indoors to be a little bit more safe for those around them because they are not wearing a mask?
So that's an excellent question. And as it turns out, the behaviors that they can adopt in order to best protect those around them are the ones that we all should also adopt over and above mask wearing, recognizing that you're talking about people who cannot wear masks. So what can they do? Wash their hands, watch their distance, and certainly stay home when they're sick. And if there are, you know, moments where a cough or a sneeze happens to come up, cover that cough and sneeze and then wash your hands. These are the things that actually we know make a significant difference. And if you are capable of wearing a mask, if you don't have a medical condition that precludes that, then we would advise that wearing that mask as well. So it's the 4 W's.